Hi everyone, I am Associate Professor Dr. Kranthi. It's a very good tool for calcification. This is a calcified canal. When we take a CBCT, you can actually draw the canal. So of course this patient, I didn't continue, the patient went off, but if the patient would have come, I know that exactly till where I have to drill. I know the amount of dentine I have to cut. So you can see there, my canal is opening from there. So I can measure the length from where it is opening and then I proceed with cleaning and shaping. So this is one more case. You see the radiograph on the left, that is, you can see that there is a very highly calcified canal, right? So this patient comes to me, of course there is a not very well done extraction, the 7, but the patient was not bothered about 7, she wanted to do something about 6, right? So this patient comes to me, referred from somebody, and I said, very poor prognosis. I gave the patient, you won't believe, I gave the patient 20% chance, not even 50. I said only 20% chance to survive, hoping the patient will say, okay, I don't want. But unfortunately, the patient said, okay, I'll give a chance. So what we can do is, we can do a nice thing in this particular machine. Again, we do something called as segmentation. You can take out the tooth out and check how the tooth is. You can rotate and check. That is what we did here. That means we can take off the what you call bone out of it. You can take it, you can color it, you can do a lot of things with it. So that's a nice feature in GreenX mode, endo mode. So this particular, you can see the left hand side, that is a segmented tooth. We can actually draw the canals. This software allows us to draw the canals. So what is the advantage of drawing the canals? When we draw the canals, you can see there, you can nicely draw, and if you look at my segmented tooth, when we draw the canals, we can check how, you can see there, one of the canal, it is merging with each other. So now I know a lot of information. One canal is going off tangent. You can see the pink color canal, it's going off tangent. You can see my mesial canals are merging with each other. A lot of information I got. So now I did my cleaning and shaping. This one will go a bit faster. I'm doing irrigation. You can see there, I can go my length. So what I did, a bit of change here. Because I know this is a calcified canal, I did a simple change. Now how you execute treatment also matters, right? I used my bioceramic sealer, again Ceraseal, inside the canal. I took a sonic activator because I already know that the canals are calcified. The chance of extrusion is almost negligible, right? So I did this. Why I did this? Because I want my sealer to reach as much as it can reach, because if it is calcified, Gataparcha may not reach into the tiny portion. So I did that. Eventually, because I did that, this is obturation. You can see that obturation done well. You can see there, you can see lateral extrusion of my sealer. So these particular cases which have got poor prognosis, you want to make sure you fill the maximum possible. And within 6 months follow up, the tooth is, the lesion has come down drastically. Now the patient is going for I think gone for a crown already. I don't have that photo. So calcified canals can be managed. Similar, I will not go into details of this case. Same thing, you can actually draw the canal, you can profile it well, you can clean, you can shape, radix entomolaris again, obturate. Okay, this is a nice case. What you can see is this patient came to me, a root canal treatment was supposed to be done, went to a dentist, and the patient was having severe pain whenever the dentist did the root canal. Okay, so the patient comes now, I was doing, still the patient was having pain. If you look at our inferior alveolar nerve, look at it now. It's very near to the root. Now my worry was, am I impinging onto the root canal? So what I did was, I took a precaution. I filled the entire distal canal with MTA because I want to make sure that I don't go beyond the apex and go into the nerve canal.